So we begin module 1 of this clinical care certification course, and this module 1 will be handling foundations of clinical care. A little catch on this is that if you have access to a large screen, please do well to watch my own lectures on a large screen. The person speaking is Dr. Antonia Soje. You may not see my face because my slides are they are full. So if you decide to watch them on your phone, you may find some prints are quite tiny and unreadable, and you will not want to miss out on important things. So this module, this presentation, though brief, we will be discussing meaning of clinical care, role of the clinical care associate, healthcare environment. We'll discuss multidisciplinary teamwork. We'll discuss patient-centered care. We'll discuss patients' rights, professionalism, scope of practice, clinical safety, communication, documentation, ethics and accountability. Then we'll also discuss escalation and seeking help. In addition to my own discussion on module 1, you would also still have a series of YouTube videos to watch that will further discuss each of these subtopics more elaborately. So beyond what it is you're watching me teach via this pre-recorded lecture, you also still want to sit with the recommended videos that are tracked on your online learning platform. So the learning outcomes for this module is that you should be able to define clinical care and patient support. You should be able to explain your role as a clinical care associate. You should be able to describe the structure and the functions of a healthcare facility. You should be able to identify the members of a multidisciplinary team. You have the doctors, you have the nurses, you have the midwives, you have the housekeeping in a hospital, housekeeping team. Those are the ones they call orderlies and ward mates. You have the clinical care associate, you have technicians, you have security system, and a whole host of personalities that makes up a multidisciplinary team. So by the end of this module 2, you want to be able to explain the importance of teamwork, and beyond explaining it, you want to be able to demonstrate it effectively as an individual. If you're going to work in the healthcare system, knowing that healthcare is a baton game, you just must be a team player. Then you want to be able to describe the patient's journey, explain the principles of patient-centered care, identify fundamental patient's rights, explain confidentiality and privacy, explain informed consent and your limits. How far can you go? What's that which is beyond your scope of practice? Then demonstrate appropriate professional behavior, explain the importance of professional boundaries, describe the graduate clinical care associate's scope of practice, identify activities that would require supervision or escalation as the case may be, explain accountability and delegation, recognize basic clinical safety risk, explain the importance of correct patient identification, demonstrate appropriate communication, explain the principles of effective handing over, recognize the importance of accurate documentation, then describe incident reporting, and then demonstrate respect for patients' dignity, and then, of course, recognize situations that are beyond your competence. Now, for what it's worth, this is quite a whole lot. So you will not be having 24 slides. For everything that is mentioned here will be touched on, will be spoken about, will not be written out as the words. So what I would advise beyond you watching this, please have a little note with you so that you're making jottings and you'll be better able to track beyond just reading the slides. So what is clinical care? It's not just performing procedures. It's a set of organized provision of healthcare services to individuals who may require either prevention, assessment, treatment, monitoring, rehabilitation, support or comfort, or all of this combined together. So clinical care then will involve ability to observe. Your observation will then mean that you're identifying But not just that you would only observe. You should be able to assess, okay, looking at this patient looks weak, this patient looks drowsy, this patient looks like they're in a bit of painful distress. So I would usually tell people that if you're going to work in the healthcare setting, you have to bring your soul, your body, and your spirit. The entirety of you have to be there. You can't just be seated and you're spaced out while your patient is with you, and you cannot observe and assess that beyond what this patient is saying, something is off. Then your ability to communicate is a two-way game. Your ability to communicate is also hinged on your ability to listen effectively and then be able to appropriately relay information to your patients, explain to them, reassure them. Those are all communication things. Then being able to offer support to your patients and give appropriate intervention if it's necessary. Now, if interventions are administered, you should be able to monitor such. So that would mean that the patient maybe comes in and needs to have vital signs assessment. You can already see that this patient is dark already, is sweating, or this patient was even shivering literally. And then you do a temperature assessment and find a temperature of 40 degrees Celsius. That's quite high. What's the intervention? Intervention within your scope may be paracetamol. But then that will mean that you also remember to monitor again. So that means in 30 minutes time, I'm repeating the temperature. Now it's no longer 40, it's 36 or 37 degrees centigrade. Then of course you're documenting, you're evaluating, and then if situation warrants that you escalate. So that patient that came with a temperature of 40 and had paracetamol and temperature came to 37, then you found that the patient was convulsing. That's a case to escalate. To escalate means you alerting a superior person to know that this patient needs attention urgently, right on the go. And situations where a patient needs to be referred or followed up. So clinical care entails a robust set of services that are offered to individuals. So, for example, taking blood pressure then is not just that you're reading a number. It is that you know patient Ojo Johnson is the patient that I have identified that needs to have blood pressure taken. So it means I would need to ask the patient for the name and make a documentation of that name and the blood pressure reading I did. Not assume, I think I know this patient, I should remember the blood pressure reading. Then you would also be able to explain the procedure to the patient. So I'm going to wrap a cuff around you, then press the button. It will inflate the cuff. You may feel some pressure, but it's not painful. So you should be able to explain the procedure to the patient. Then be able to perform measurements correctly, observe and interpret within your scope, because patient may then ask you, what's my blood pressure reading? Or maybe it's 130/80. So you are able to observe, you're able to give the reading, and the patient asks you, is that normal? Within your scope, you should be able to interpret basic vital signs and then document correctly. And if they have normal findings, communicate. And most importantly, to the superior colleague, if you are communicating with your patient, you want to communicate in a way that it doesn't bring anxiety. Okay, so the blood pressure is a bit high, but you'll be seen by the doctor and then with medications and of course every other things that may be done for you. We expect the numbers to come down. So you communicate in a reassuring way with your patient. And situations, like I always say, where you need to escalate, and you get it across to the next person that you are passing the baton to. So the clinical care associate is the key member of the healthcare team. So it's someone who is trained to offer clinical support, who would contribute safe, compassionate, and effective care to patients within defined competencies, institutional protocols, and appropriate supervision. So there's a set of competencies that is expected. Okay, this one you can do this. This is within your milieu. Train you with, we've tested you, we've verified you, and we know that you can safely perform this. And based on institutional protocol, this is the much you can do within this facility. You can't do more than that. So you're following the institution protocol, regardless of whatever it is you do, wherever you're coming from. Then, of course, appropriate supervision. Everybody needs to supervision. Even doctors will take supervisions every now and then. So the graduate clinical care associate then contributes by helping to observe patients, monitoring vital signs and patients' conditions, supporting the patient with basic care needs, assisting with clinical procedures in situations, and again, based on competencies and job description and designation, collection of approved specimens, being able to communicate patients' concerns clearly, being able to escalate abnormal findings, documenting accurately and timely. Documentation must be accurate and must be timely. If you perform the procedure by 8 a.m., the documentation must happen at the latest 8:15 when the memory is still fresh. If you perform the procedure by 8 a.m. and then you decide to document by 10 a.m., I tell you, except you work in a place where you see only one patient, because of the multiplicity of cases and persons you would have seen subsequently, your memory will not be so fresh of that which you did at 8 a.m. So you likely may be guessing and maybe confabulating. Confabulating is you're not planning to lie, but then your mind just puts up a figure for an explanation. So there and then, once documentation is not correct, is not accurate, patient's response may not be as wonderful as it could have been. Then the GCCA would also promote safety and infection control and work as a team with respect and accountability. So your role is built on 4 strong pillars or 4 strong principles, if you want to call it. Competence is that you will do only what you've been trained and assessed to do, but you also want to be at the cutting edge of precision in that which you are being trained to do. No lapses, no error. 2 is that you're accountable. You take responsibility for your actions, for your missions, for documentations, for whatever it is that happened. Be able to own up as it happened. In fact, that would also mean that something happens before it's discovered. You should have that accountability spirit to be able to own up, to be able to speak up ahead of time. And when there are some procedures, even if it's an emergency, if you should be able to know, this I would appreciate if another person puts an oversight over such a procedure. So you want to know when a task requires supervision, and then escalation is one word you will hear so very often. Recognize when your patient's condition is getting bad, or when a task is beyond your scope of practice, and be able to pass the baton to the next person. So now we'll begin each of these sub-headings. The first one is infection prevention and control. Infection prevention and control will protect you and your patient. So it's everybody's responsibility. So key practices you want to keep in mind for every procedure where you come in contact with bodily fluids, with saliva, with urine, with sweat, with blood. You want to perform hand hygiene before and after every of such patient contact. So you did a vital sign assessment for the patient who was all sweaty. You have to go and perform hand hygiene with soap and water. If you work at health, you will find a wash point beside every nursing station. So you perform hand hygiene. Then use appropriate personal protective equipment. If it's gloves you need, be sure you're using the glove. If it's face masks you need, be sure you're also using that. Then you want to handle sharps safely. Sharps are not meant to be recapped. Needles and stabbing pins, lancets, those are not meant to be recapped. Then you want to clean surfaces and equipment and disinfect them daily, sometimes more than daily. Once you see that there's a spill, there's a soil, there's a stain, you clean, you disinfect as often as possible. Even if it's the tourniquet that is being used for phlebotomy or for IV cannulation, you want to disinfect as often as possible. Then in situations where there's a need for isolation, every facility will have its own isolation protocols and precautions. You want to follow those to the letter, because the aim is to break the chain of infection. The agent is already there. So your possibilities are, is it possible to prevent the agent from exiting? Even if it's from being transmitted. And if possible, can I prevent it from finding entry into another host? At this point, where you can break the chain of this infection is your targets in infection prevention and control. So that would also mean that you are using your personal protective equipment appropriately, as at when if you have to do phlebotomy, take blood sample for a patient. Oh, just wear glove. Glove, you're protecting yourself, you're protecting the patient. You have to do a wound dressing. Wear face mask because you're reducing the microbes in your airway from contacting the patient's wound. So now we come to patient-centered care. Your patient is more than a diagnosis. Your patient is a human being with identity, with feelings, with desires, with dreams. So it's more than the diagnosis of malaria, of pneumonia, of appendicitis, is a human being with relations. Just I like to personally do a role reverse. And when I have a case sitting in front of me, I mentally do a flip of if it was me sitting on the other side and this is the patient sitting on the doctor's side, how would I want to be treated? If the times I do this intentionally well, many times I would be able to really offer patient-centered care. And it means that your patient is being treated as a whole person with his or her own unique needs, values, preferences, concerns, and dignity. So the principles you want to keep in mind for patient-centered care is that you treat every patient with respect and courtesy. I usually tell people that if you meet this same patient outside the four walls of the hospital, without every shadow of doubt, you will not speak to them or interact with them the way you did in the hospital. You want to get in such situations to then realize I could have spoken better. I could have been more cautious. I could have been more respectful. So you want to treat patients with respect. You also want to listen actively and communicate clearly and kindly. So your communication skills has to be on point. Then you want to involve patients appropriately in decisions about their care. So that would be a patient who comes in whose temperature is 40 degrees. 40 is high. Your conversation with the patient and your desire to treat this person respectfully will then be Mr. John or Mr. James. Even if it's a 16-year-old, it's still Mr. John or Mr. James. Your temperature is 40 degrees Celsius. We have a hospital protocol to administer intravenous paracetamol, pending when the doctor gets to review you. Would that be all right with you? Would you want me to go ahead? So you're involving the patient in such decision, not that you just yank the patient and put a cannula and then you're giving medications without explaining. So you want to carry your patients along. And situations where your patient's privacy, bodily privacy, has to be protected. Maybe you're doing a procedure that we have to cover up, we have to close the door, we have to use frames. Please get that done. And confidentiality means that whatever transpires concerning your patient's health, treatment, complication, development, progress, as the case may be, ends with you and fellow medics. It never goes outside the hospital. In fact, it will happen between you and fellow medics because there is a medical discussion about it, not that there is a social or jovial discussion about it. Then patient-centered care also involves showing empathy and responding to your patient's needs. And that also means that you also be culturally sensitive. If you work at health, you will find all spectrums of patients. You'll find the Fulanis, you'll find the Hausas, you find those who don't understand English or Yoruba, as the case may be. And cultural sensitivity will then mean that you will be willing to tilt a little to be able to make that um, patient experience a pleasurable one for them. And if it's a culture or religious belief where there are some nuances, as much as you can medically and professionally bend to absorb and tolerate such, why not? That's what makes it patient-centered care. Then promptly responding to your patient's concerns and changes in their health status. So the patient that has a temperature of 40 and then now temperature is 36 and now is sweaty and had 3 layers of cardigans on before the administration of paracetamol. if you're going to be responsive, those layers of sweaters have to come up. But it means that you're being patient-centered. That's why you'll be able to observe that. Then keeping in mind that quality and safety is the goal. So you want to provide safe, effective, and high quality care at all times. So example would then be maybe you have a patient who needs blood. It's not the mama in bed 4 or the mama in female ward needs blood. Who is the mama? What is the person's name? Is it Mrs. Adewale in bed 5 needs blood? So you identify that person as an individual with a name, with unique desires, with unique needs and values and preferences. So every patient is a person. While it's important that you have excellent laser precision clinical skills, how you make your patient feel is equally as important. So then we come to patients' rights. There's a set of patients of rights that every patient has, whether they know it or they don't know it. The essence of you knowing it is so that you can give it to your patient. But I prepare this slide with the mind that you will see yourself as a patient and know what right you have. So with that awareness, you then extend that same right to your patients. So every patient deserves respect, dignity, and quality care. They are not just passive recipients of care at any facility. They have rights that must be respected at all times, and there are 8 sets of legal rights that a patient has. This is not ethics of medical profession. This is patient's rights, that if a patient is going to sue you, it will be that you flaunted one or more of these rights. So as a patient, in this case, I've done a role reversal, you are the patient now. You have a right to dignity, right to be treated with respect and not to be humiliated, discriminated against, or abused. So patient cannot come and you just speak to them anyhow because they are the one who needs care. That would be you robbing them of a right to dignity. Patient also has rights to privacy. So they have the right to privacy in their interaction, care examination, and environment. So patient can tell you, please, could we step aside? I need to tell you this privately. And there's nothing like you tell them, no, 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 you either say it now or you forget about it. Your hands may be full that time. The appropriate professional thing to say is, okay, I'm handling this. If it's not urgent, could you wait a while so that I'll be able to attend to you? If it's urgent, could I pass you to my colleague who will be able to take care of that? Then right to confidentiality. Your patient's personal and medical information must be kept confidential and disclosed only through appropriate channels. The appropriate channel is the medical channel. There's interactions between medics, clinical documentation, and in situations where a legal request is made for such personal and medical information. That includes things like genotype, like your patient's age. But your patient is 27, you got to know because the patient came to the hospital. If you had met the person in church or in a shopping mall, if you don't have an interaction that requires the person to tell you his or her age, you would not know. So that's also confidential information. So your patient also has a right to information. They have the right to receive information about their condition, the care they are having, the treatment in a way and a language that they would understand. So if they ask you what is wrong with me, okay, let me look through the doctor's notes. From the doctor's documentation, you have malaria, and currently you're being administered IM EMAL 150 milligram daily for the next 3 days, after which we expect you to be fine. There's nothing like how can you be asking that kind of question? We're giving you treatment now, so we expect you to get better. Your patients have a right to being informed about their condition and whatever care and treatment they are receiving. They also have a right to participate in decisions about their care. They have a right to give or refuse consent appropriately, assuming that they have a sound understanding of what it is what it is they are deciding. So a patient says, I don't want surgery, and you are sure that this person understands the implication of declining such a surgery. Why not? They have a right to participate. So you will not go ahead with the surgery and find the next best option as a way of taking care of such a patient. Then they have a right to emergency care. They have a right to be treated without delay or discrimination in situations that such arises. Then if they are not pleased with any form of treatment, they have a right to raise concern or make complaints, and they have a right to receive a fair response. They also have a right to fair treatment. Fair treatment is equitable, is compassionate care without discrimination based on their age, their gender, their religion, their race, their status, or financial conditions. So, patient rights summarized would then be dignity, privacy, confidentiality, information, participation, feedback, and redress. Whatever happens, your clinical skills must never compromise patient's humanity. So we come to professionalism and professional boundaries. How should you conduct yourself? Professional conduct will help to build trust. People will trust you, will protect your patients, will strengthen the healthcare team, and reflect you as an individual with integrity. Professional Professionalism is as simple as being punctual. If resumption time is 8 o'clock, do not come by 8:30. Is appropriate appearance. You are well groomed, well shaven, hair is well made, and makeup is moderate, jewelry are non-flashy, clothes are well ironed, just things that anybody looking at you knows that this person is a serious-minded individual. Professionalism is also respect, treating people with respect. Professionalism is honesty. Be reliable. If you say you're going to be there by two, be there at two. Be a person of your word. If you say you're going to assist with the wound dressing, don't bail on the person you've made a promise to. Being accountable, owning up to your actions, your documentations, procedures that you performed. Professionalism is also being able to hold confidential information, being willing to learn, having respect for supervision. What are some professional boundaries that you don't want to, at any for any reason, flout? So you want to avoid inappropriate personal relationships with colleagues, with patients. For what is worth, why the patient is within your care is not a person you can date. Then asking patients for money or favors are things to avoid. Unauthorized social media contacts, inappropriate physical contacts, sharing confidential information about your patient or about yourself, accepting inappropriate gifts from a patient, or using patients for personal benefit are professional boundaries that at all costs you want to avoid. So then we come to patient safety. One thing you want to keep in mind here is that your patient safety must come before speed. And if something is unsafe, come what may, just stop. There is an African adage of the Yoruba community that says, "Òòṣà tó ò bá lè gbà mí, fi mí lẹ̀ bó ṣe bá mi." And that's translated as, if the gods cannot save me, they should leave me as I have been, not make the situation worse. That's the case of the medic. So the patient cannot come with a headache, but because you fail to prioritize safety over speed, you now then give them an open wound or you give them a medication complication. So every clinical encounter must begin with safety. And safety is everyone's responsibility, regardless of your cadre or pedigree in the healthcare team. Some safety check you must do, whether for oral medications, intravenous medication, even for vital signs assessment or procedure is identify correct patient. So you call and ask the patient again, are you Mrs. Ojo James? Are you Mr. Christine Taiwo? Then you now check again the procedure, the equipment, and the instructions. Every facility would have a documentation protocol, either on the electronic medical record system or on the physical card. So you want to check procedure, equipment, and instructions. Then you want to now explain in a language that the patient will understand. So does your patient understand what is happening? And when you're going to perform your procedure, you follow the approach protocol for such procedure and then observe, is your patient responding appropriately as is expected? If you give paracetamol, it should be that temperature calms down. Patient should not become breathless, should not become dizzy, should not pass out from paracetamol. That's an inappropriate response, but you'll be able to catch that if you're closely observing your patient. Then you want to document, record accurately. If it wasn't written down, it was not done. And if you find abnormal findings or complications or things that are beyond your level of competency, you escalate appropriately. So we then come to your ability to recognize deterioration in a patient and as escalation. You don't need to know your patient's diagnosis for you to know that something is wrong. Some warning sign in every and all patients that should let you know that something is wrong without you even knowing what is wrong yet is a patient who suddenly develops difficulty in breathing, a patient who develops severe crushing chest pain, a patient who passes out suddenly or has severe bleeding or has a new onset confusion, not someone we've admitted for confusion or the confusion worsens. A patient with reduced level of consciousness, patient who comes in convulsing or is convulsing while they're being attended to, a patient who is cyanose. Cyanose just means they have more of desaturated oxygen, so they will have bluish discoloration of the mucosa and the sclera. So if you see that, you know that's a warning sign of a clinical deterioration. Then if there is marked abnormality in the vital signs, or just generally the patient begins to deteriorate, you know something is going on. So as the GCCA, then you should be able to recognize the change, should be able to respond within your level of competence and then escalate promptly to the appropriate professional. So your ability to know when to seek help on its own is a clinical competency, and every medic must have that. So then we now come to communication, documentation, and SBAR. Communication again is a clinical skill. Communication should be clear. What it is you want to get across to the patient should not be mumbled, should not be confusing. The patient should not be struggling to figure out what it is you're communicating, either to your patient or to the colleague. Then communication should be respectful. It should be accurate, straight to the point. So there's no sentiments, emotions, and a number of other unnecessary things you want to put in the mix of it. It should be concise, brief as can be swallowed in 2 or 3 sentences, as can be relayed in 2 or 3 sentences, so that you don't lose the patient in the endless on and on of what it is that you're trying to communicate. And your communication should be patient-centered and appropriate to the listener. So if I have someone who is not so educated, I want to break it down in a way that they will be able to grab it. But if I'm talking with a professor, I will be able to go into the nitty-gritties of the science and how this applies and a number of other things. And when you're communicating, you want to remember that how you say it is just as important as what you say. So HESBA is a handing over protocol that once you keep it in mind, you know, there's S, there's B, there's A, there's R, and you want to do a quick handing over or a quick, handing over, you pass the baton to another person. You can just give them in 4 sentences what is expected. So situation, what's happening with the patients now? So Mr. James came in with a temperature of 40, vomiting and stooling. That's what's happening. So what's the background information that is relevant? Okay, since he came, we're giving paracetamol, giving IV fluids, the doctor has been notified. What's the assessment? We're waiting for doctor to review this patient. However, we'll send samples to the lab. What recommendation? Recommendation is as soon as the lab results return, the patient should be seen by the doctor. That is by straightforward. It's not cumbersome, it's not all over the place. So your documentation should be accurate, it should be timeless, it should be objective, it should be complete, and it should be confidential. So there's a clinical mindset you must bring to fore for every interaction you have with your patients. So before any clinical procedure, a clinical task, you should be able to ask, who is the patient I'm attending to? So it means you're calling patients, addressing them by their name, Mr. James, Mr. John, Mr. Tolu. Then what am I being asked to do? We're performing vital signs, we're doing wound dressing. Why is it being done? Then how do you do it safely and appropriately? Then are you competent? Have you demonstrated this skill? Have you been tested? Have you been verified? Have you been supervised a number of times? Then are you authorized? Is it within your role? So now, supposing something changes, would you be able to recognize if there's complication? Would you be able to know, identify, and then would you be able to escalate as the case may be? So what you want to keep in mind is the knowledge will give you the foundation. The competence will allow you to practice safely, and professionalism will ultimately guide everybody's behavior. And teamwork will protect the patient, and compassion. You just must bring that to the healthcare game. You have to bring that to the healthcare game. So kindly do well to sit with the other recommended videos, sit with the reading resource that has been uploaded, and then we'll see you in the next module. Bye.